This audio is brought to you by B, the parenting app.
ADHD, Attention Deficit Hyperactivity Disorder. I think my child may have ADHD. How do I find for sure? What is ADHD? ADHD is, as the name suggests, Attention Deficit Hyperactivity Disorder. But mostly, all children are hyperactive. The only difference between the child suffering from ADHD and the normal child who is hyper is that a child with ADHD will have aggression issues along with lots and lots of pranks. These pranks can include doing damage to properties, getting hurt themselves, or hurting others. So, a child who is doing this can be termed as a child having ADHD. A child suffering from ADHD is unable to concentrate even in the activities he enjoys. He gets hyperactive all the time and fidgets a lot. But this is not the only diagnosis. So if you think that your child is suffering from ADHD and you want to find it out for sure, then you have to go for a full diagnosis, either by a developmental pediatrician, a psychiatrist, or a psychologist who does a complete assessment of the child along with the parents, and then they finally give a diagnosis that the child is having ADHD issues. Sometimes the child is just hyperactive or has attention issues. All these things are different. You can't just generalize any of this. Now, say for example, you have gone for a diagnosis and the child is suffering from ADHD. If the severity is very high, it is suggested that you consult a psychiatrist. The psychiatrist might give some medication if it is required. It is not necessary that in every case the medication should or have to be taken. If it is on a very higher tangent, the child can be given a certain amount of medication, that too from a well-equipped psychiatrist or a pediatrician. A continuous CBT therapy is given to a child to help him mellow down. The first step towards recognition is getting proper diagnosis done from the expert. For more insights, download B, the parenting app. Thank you.